And this is not the only problem. We are seeing that there is a rise in the cancer incidence with every passing year. Uh, Although there are certain cancers that are decreasing, but if you look at breast cancer and lung cancer, the incidence is rising very sharply in this developing country. And also, we find that not that other cancers such as cervix cancer are decreasing that sharply. So overall, the cancer burden is definitely increasing. Not only this, we know that our overall population is increasing, so there is a demographic effect as far as the cancer is concerned. So as the population is increasing, as the population is aging more, and looking at our pyramid, which is like a normal pyramid and not like the US pyramid, which is an inverted pyramid, but our pyramid, population pyramid, is also changing and is becoming more cylindrical. That means we have equal distribution of patients or equal distribution of population between very young and very old. So, as the population pyramid is drifting towards an inverted pyramid, which happens to all developing countries, the population pyramid in US was not an inverted pyramid to start with. So, as the population starts aging, the cancer incidence keeps increasing. So we know that India is going to face a real cancer burden. And so with this, we definitely need an immense workforce to work in oncology. And there is definitely there is a lot of scope of improvement, and there is a lot of scope of newer people who are trained in oncology. When I started my own career in oncology way back in 2007, there were only 14 medical oncology seats all over the country. Although this has definitely increased to almost around 100 seats today, including the DNB seats. But there is definite need of support staff to support trained medical oncologists and trained radiation oncologists to work to increase the entire workforce. So for that, we have this particular course, which is career opportunities in clinical oncology, to develop simultaneously the workforce to work with seniors who can and take up career in oncology and work as support staff and support doctors in oncology. And so this is one course which gives you a clear headway of what oncology requires and what is required out of a person working in oncology. It also gives you quite hands-on training about how to write a chemotherapy, what is the journey of a cancer patient of different various malignancies. So it also describes a lot of one second. So it definitely describes a lot of common cancers as case capsules. So it does describe how does the cancer, the cancer journey is for a breast cancer patient who starts off with a localized disease and then has a metastatic disease. So they are hypothetical cases, but then it describes the entire journey of a cancer patient. So which definitely drives home a very clear message and helps you get trained in whatever is latest happening. The second important thing is about this course is that it upgrades itself. So as new information comes in, the course gets upgraded with every passing year, and newer case capsules may be added. It also provides you hands-on training of about a month or so, wherever you can choose to have a hands-on training in oncology. So we have also realized one very important thing, that during the MBBS training, the oncology exposure is much less, and we don't really come to know of much of oncology work because that's not really what is practiced in various medical colleges. As a matter of fact, as I said, that in 2007 we had only 14 medical oncology seats throughout the country. So that means a very few medical colleges had oncology seats. So there is definite dearth of oncology training, and this particular uh, career opportunity in clinical oncology exposes the person who has passed out of MBBS to oncology care, and within 6 weeks or to 3 months of training, hands-on and case capsule training and the theoretical training, I think it gives you a good headway of making a good career in oncology. So not only this, it can fetch you a better job profile rather than just working as a plain MBBS doctor. If you have something to back up as a clinical oncology training, you easily gets absorbed into an oncology program and can provide reasonable good care to oncology patients. So this is a certificate course in clinical oncology. It describes advanced certificate course in clinical, and so there are three courses, there are three learning pathways, and of course there is a fellowship in clinical oncology. So this is a 6-week contact program with case capsules, with various case capsules presented throughout the course, and which helps you gain knowledge and improve your skills in oncology. So this is what I had to add in this particular discussion. So I'm very happy to take any questions in case there are any.